I wanted to start by giving you a situational update about what's happening with COVID-19 infections around the country and in Alabama. And then I want to talk to you a little bit about new health orders that are being issued by this department today. As you are probably aware by now, we have over 9,000 cases of COVID-19 infection in the United States. There have been over 150 Americans who have died from this disease so far. In Alabama, we have, as of this morning, 68 cases, although fortunately no deaths yet in Alabama. The 68 cases that we have as of 8 o'clock this morning represent more than a 40% increase in the last 24 hours. We're certainly aware that as we are testing more, we are picking up more. It seems as though wherever we look in the state, we are finding cases of infection. We are concerned about the fact that at least half of these cases that we know of have not had any significant travel or certainly not any international travel history. These are patients who either have resided only in Alabama or have perhaps traveled within the United States, but they do not have other obvious risk factors for infection. We believe that we have community transmission going on in our state. We have different pockets that we have identified. As you're aware, on Monday, Dr. Mark Wilson of the Jefferson County Health Department issued health orders for Jefferson County, and on Tuesday, this department issued similar orders for 5 of the counties that surround Jefferson County. As part of the containment strategy, we are seeing increasing number of cases now in Lee County as well. And as I mentioned, we have a total of 68 so far from this morning. So to that end, I wanted to announce to you health orders that are being issued today by the state health officer with the Alabama Department of Public Health. Effective today, March 19th, 2020 at 5 p.m., all gatherings of 25 persons or more, or gatherings of any size that cannot maintain a 6-foot distance between persons, are prohibited throughout the state. This order shall apply to all gatherings, events, or activities that bring 25 or more persons in a single room or a single space at the same time. Effective today, March 19th, 2020, at 5 p.m., all beaches shall be closed. For purposes of this section, the term beach means the sandy shoreline area abutting the Gulf of Mexico, whether privately or publicly owned, including all beach access points. Effective Friday, March 20th, or actually at midnight tonight, all senior citizen center gatherings shall be closed. Senior citizen centers and their partners are urged to assure their clients continue to receive needed meals via curbside pickup or delivery. This is actually effective at midnight tonight, so that these centers would not be in violation of the order when it is issued today. We wanted to allow them a time to take care of their clients today before discharging them. Effective at the close of the school or business day today, March 19th, all of the following shall be closed. All schools, public and private, including but not limited to elementary, secondary, post-secondary, technical, or specialty schools, and colleges and universities. This school closure order is not intended to prevent any employers from making continued necessary staffing decisions. Employees are authorized to advise employees to work from home or maintain flexible work schedules. Effective today at the close of school day or business day today, all preschools and child care centers in the state are closed. This shall not apply to certain child care centers that are operated for the exclusive benefit of essential employees for certain categories of employers. This does not apply to child care centers that are caring for the children of essential employers for state and local governments, first responders, including EMS and fire services, law enforcement, hospitals, nursing home, long-term care facilities, including assisted living facilities and specialty care assisted living facilities, and end-stage renal disease treatment centers, as well as pharmacies and groceries. Effective immediately, all hospitals and nursing homes and long-term care facilities, including assisted living and specialty care assisted living facilities, shall prohibit visitation of all visitors and non-essential health care personnel, except for certain compassionate care situations, for example, end-of-life situations or maternity situations. Effective immediately, all elective dental and medical procedures shall be delayed. This is not a closure of offices for physicians or dentists or optometrists. Those offices remain open, and those professionals continue to care for their patients. They are still available to care for urgent and emergent situations, but all elective procedures shall be delayed. I would remind people that elective can be somewhat subjective. The CMS issued guidance last night that's available on their website about what could be considered an elective procedure. Effective today, March 19th at 5 p.m., all restaurants, bars, breweries, or similar establishments shall not permit on-premises consumption of food or drink. Such establishments may continue to offer food for takeout or delivery, provided that social distancing protocols, including maintaining a consistent 6-foot distance between persons, are followed. Such establishments are strongly encouraged to offer online ordering and curbside pickup. Hospital food service areas are excluded from this order, provided they have their own social distancing plan. I want to say we realize that certain bars, for example, or nightclubs may not serve food. This effectively serves as a closure order for them if they do not have food available for takeout. We regret that that became necessary, but that is the order effective at 5 p.m. today. There are some possibilities of obtaining an exemption from this order for the organizers or sponsors of certain suspended events. There's a mechanism within this health order for them to seek that exemption. A determination shall be made to whether to extend this order on everything that I've mentioned today sometime before April 6th, 2020. That's about 2.5 weeks away. These orders actually expire at midnight on Sunday, April 5th, and we'll make a further determination whether to extend them sometime before that. I want to say explicitly that there is authority for us to amend these orders at any time. We don't have to wait until that time. There may be additional exceptions that we have failed to consider or other situations that may change and cause us to need to amend this order, and we have the authority to do that at any time. These orders are issued for all 67 counties in the state, including Jefferson County and Mobile County. It's not the intent of this order to supersede any stronger actions that those health officers may wish to implement themselves. Dr. Mark Wilson in Jefferson County and Dr. Bert Eichel in Mobile County are the health officers for those counties, and they certainly have the ability to implement additional health orders, and we would almost certainly fully support them in that.